Good afternoon and welcome to NHS Hull CCG annual general meeting of 2021. It's actually our last one as a CCG this year, and I'd like to welcome the panel members. First of all, Dr. Dan Roper, who's our clinical chair, Erica Daly, who's our Chief Operating Officer. Emma Sainer will also be giving a presentation, who's our Finance Director, but she isn't with us at the moment, but there will be a presentation from her. She recorded earlier. And then we'll have questions and answers which are submitted by the public. They've been submitted in advance, and that discussion will be hosted by Jason Stamp, who is a lay member for patient and public involvement and also our Vice Chair. So, in terms of our local NHS response, I'd like firstly to thank all the NHS staff and other key workers for the fantastic performance throughout the COVID pandemic. I have to say, in all the years of my career, I've never seen people working so hard, so tirelessly in such a challenging time, and I want to pay tribute and thanks to all of those on the front line and everybody who supported the work to happen, including all key workers and other public sector staff, teachers, police, fire, our local authority colleagues. Everybody has pulled together to really respond in this very challenging period. What I would say, though, we have delivered a very high standard of healthcare in this extremely challenging period. Our doctors have been working, our GPs have been working. They've probably seen about 20% more activity in the last 6 months than they saw before COVID started. So I'll know it's quite difficult sometimes to access a GP at the moment. Believe me, people are working very hard. And we've delivered over 1 million vaccines across Humber Coast and Vale. We've actually delivered some of the highest COVID vaccination rates in the country. And again, that's testament to all of our staff and our GPs who are delivering this on the front line every day. The NHS was also awarded the George Cross, again, for all the efforts and everything that was done. And we've had fantastic support from our volunteering community across the Humber area. And again, can't thank people enough for all their support and help in ensuring that people received the COVID vaccination over the last 12 months. Okay, so in terms of our challenges, well, clearly we've got some issues in terms of the recovery of services for people waiting for treatment, for those waiting for planned operations. Obviously, because we've had COVID, we had the pandemic, we had to stop some of those treatments for a while. And we are starting again, but we understand that people are waiting, and we're doing all we can to support people whilst they're on those waiting lists, knowing that we've got to work differently in the next 12 months to try and make sure that we can see as many people as possible. We are clinically prioritising those patients, so hopefully, you know, if you are worried, please do contact your general practitioner who will be able to help you. In terms of health system pressures, I've already talked about the demand on general practice, it's huge, but also on other services, community services, on our hospital, in our accident and emergency department, and in our mental health trust as well. So there is huge pressure on the system well before we enter the winter period this year. We've also got some huge challenges around workforce in terms of recruiting and retaining staff. But we're doing what we can to try and get our next generation, our young people into health and care environment, and to try and retain staff where we can and attract them to our area, because it is a fantastic area to work in. We're also doing an awful lot on tackling health inequalities. Sadly, the pandemic has again put additional pressure on families and people trying to deal with this. And so we've got a huge ask moving forward to deal with health inequalities by working with our local authority and with other partners, really to tackle the wider determinants of health, such as housing, skills, jobs and education. And only if we work together can we try and transform the way we work moving forward. So from April next year, the CCG will be abolished, and the Humber Coast and Vale Integrated Care System, known as the ICS, will serve 1.7 million people, and this will replace the existing CCG in Hull and the other 5 CCGs in the system which are on there, which is North Yorkshire, the East Riding of Yorkshire, North East Lincolnshire, North Lincolnshire and the Vale of York. So what we'll see is much more place-based working in those 6 places. We'll see the NHS and local government as equal partners, and again, the things I talked about there around housing, education, skills and employment. We can only get healthy people if we work truly in partnership. So it really does strengthen the role of that joint working moving forward. We still need to retain strong clinical and professional leadership, And again, we're lucky to have had people like Dr. Roper and other clinical professionals sat round our table in the clinical commissioning group, and they've helped us inform what we do. They are our eyes and ears in terms of seeing patients every day and bringing that information and intelligence back into the way we plan services, and we need to retain that as we move forward. And as I said, local delivery through 6 place-based partnerships and also working with provider collaboratives, and that means basically different organisations, be it hospital, mental health trusts, working together in a non-competitive way to really try and strengthen what we're doing. Really important is about having thriving communities, so we really need to ensure that all of our engagement activity really does start to focus on each of those individual communities and neighbourhoods. For example, we know that even in Hull, from neighbourhood to neighbourhood, there are different issues, and we need to ensure that we set services up that meet those needs and that we don't just blanket commission, as we probably have done in the past. So those 6 places are the ones I talked about, and we're operating within 2 geographical partnerships, the Humber, which is Hull, East Riding, North Lincolnshire and North East Links, and North Yorkshire and York is the other partnership. Obviously, we need to reflect our local differences and the urban and rural nature of those places. And again, it reflects patient flows into 3 hospitals, so not just North Lincolnshire and Goole and Hull University Hospitals Trust, but also York Teaching Hospitals Trust, which is another hospital that we work with. So in terms of place, and Erica and Dan will talk to you much more about this as we move forward, we're going to have much more joint decision making and delivery to meet immediate care and support needs, designed flexibly to reflect what works in that area. Now that might sound like words, but actually it's about the leaders in this city sitting down, talking about what matters to people, what we need to do to ensure people live healthy, happy lives, and how we can work together with our providers in a different way, because as I said, there is no internal market now. So our focus has to be on what our population health needs are and how we collectively meet those as a strategic set of leaders really batting for our city in Hull. So that's basically what the place-based arrangements will look like, and Erica will talk to you more about that in her presentation. So now, in terms of timelines, we're in the development stage. From October, November, we'll start to test some of these arrangements in shadow form with a view to operating in April 2022 and then maturing as a system. I think the start of these changes will probably be the 1st of April, but we need to make sure whatever we do, we don't lose the voice of the patient, we don't take our eye off the ball in terms of what matters to people, and we continue to support the people in Hull to get the best possible health and care they possibly can. So now we've got a short video on the vaccination programme in Hull. Thank you.
Thank you. I hope you found that video interesting and informative. And for us, it's been very inspiring as well to see our colleagues work so hard to deliver 40 million vaccines in the NHS to really get us into a position that we are today. And primary care has been at the centre of that. My name's Dan Roper. I'm the chair of Hull CCG and have been for the last 9 years. And this is our 9th and final AGM. And my task in this situation is to give a bit of an overview of CCG activities, those of the NHS more widely, and the context that we are operating in. And that context now, at this particular time, is extremely challenging for some of the reasons that we've heard from Emma. And we're not going to shy away from that. The pandemic has had a profound effect on the way that services are delivered and accessed in primary, secondary, mental health services and acute services and community services as well. There's been severe disruption to waiting lists, procedures and treatment, and it's going to take a very long time to work through. Everyone has to be reasonable and patient, and then those who need to access treatment can be prioritised. As I said, this will be our last AGM. We will cease to exist on the 1st of April next year because of the changes that have been outlined by Emma and the development of the ICS. Place will still be represented, as we have done in the past 8 to 9 years, but not quite in the same way. It's always been very difficult to explain what a CCG exactly does, is, or was in the future, but it is clear what it did and what might not have happened had it not existed. That's a mixture of what we had to do, and a CCG has 168 statutory duties that it has to perform on behalf of the health service. And what we wanted to do as public sector leaders, demonstrating the power and influence of the public sector. If we've learned anything in the last 2 years, it's what the essential jobs are, who's doing them, and how much we appreciate them. We need to remember that these people do not grow on trees. They take years to develop and are very, very difficult to replace. I've always been a little bit dubious about the greatest hits format when there's still so many unresolved issues and problems and people have so many unanswered questions. But we will do our best to be honest, open and realistic in the Q&A session. We will try to tell it as it is. There's still much to do, tons to do, but in the future it will not be the CCG doing it, facing the challenge around demand, access, workforce, backlogs, effects of disadvantage, the ongoing pandemic and the system's recovery from it. In 2013, we set out our intentions, which were to develop 21st century primary care, integrate health and social care services, and produce next generation healthcare with young people taking control of healthier choices throughout their lives. Have we done that? Well, we've certainly tried. Have the conditions in society changed in a way that have impacted on those aspirations? They certainly have. Every year we've worked as a CCG to do our utmost to improve outcomes for patients, improve the health and well-being of the general population, and improve the landscape for health and social care staff. I'm certainly not going to stand here and say that we've succeeded in everything that we've tried, but that would not be through lack of commitment and effort on everybody that works at the CCG. We've just got to keep trying, remembering our key principles of partnership working, building relationships, a strong sense of place, underpinned by the concept of social justice and fairness for everyone. It's been my honour and privilege to be the chair of the CCG for 9 years, and I can't thank everyone enough who has worked for and with the CCG. So I'm just going to run through very quickly a bit of the history of what we've done, particularly from the non-statutory side. So if I could have the next slide, please. You remember the Hull 2020 Champions vision that was established around about 2013 by Emma, and it was really about building health partnerships across the voluntary commune and social enterprise, also with other public sector workers in the public sector organisations in the city. The Healthier Hull Community Fund awarded £360,000 to 79 projects across the city. Through this, we reached 22,500 people. And we all remember fondly those events where we engaged with the voluntary and sector on that. So the Hull 2020 Champions was launched, allowing community groups to become actively involved in promoting health and well-being. And we had over 100 organisations. The next slide, please. In 2015, we established, with colleagues at St Mary's, the Medical Health and Social Care Academy. We realised that we needed to grow our own workforce. And from a school that traditionally or in the past had not been able to secure places at medical school for its students who wanted to pursue a career in medicine, we've now got 6 or 7 young students per year moving on to higher education in medical schools, both local and throughout the country. But it's not just about medicine. We've been successful working with colleagues at the school, and I can't thank them enough, for getting young people into nursing degrees, social work, paramedics, radiology, physiotherapy. About 70 students a year are now undertaking higher education, pursuing their dreams of working in the public sector. We also introduced the Working Voices initiative, which continues to develop, highlighting the voices of working people in health service planning. And we also introduced a social prescribing service, allowing patients to be referred to local community and voluntary groups. The next slide. Moving on, you will recognise this as the Jean Bishop Integrated Care Centre, and Erica's going to talk more about this in the future, but this innovative facility, the first in its country to support integrated out-of-hospital care across health, social care and community housing. We also developed a locally accredited older persons nursing fellowship, and one thing I'm particularly proud of, which was the Down Syndrome Care Pathway and Clinical Guidance launch. And I remember that occasion with a great deal of fondness and pride, not just in what we'd done, but particularly in the parents and carers and the young people themselves who attended that meeting. It was particularly moving and satisfying. And we also opened a mental health crisis pad. Moving on to the next slide, we're coming up to more towards the 2020-2021, when the pandemic hit. Had a significant impact on health, particularly the most vulnerable in Hull, and health services required to adapt quickly. Health and social care was under extreme pressure, and the COVID vaccination programme, you've seen the video, but that was undertaken. We also distributed 500 plus tablet devices to provide to care homes to ensure that residents remain connected to GPs during the pandemic. And the targeted lung health check programme that was introduced the year before, and Erica's going to talk a bit more about that, recommenced, which was a really important part of the work that we do. We partnered with Migration Yorkshire programme to provide mental health and therapeutic support to refugee children and families traumatised by fleeing war and refugee camps. And Hull CCG became the first ever CCG of sanctuary in the country, recognising its contribution to the health and social care, working with partners across the city, those people seeking asylum and refuge in our country. And a dedicated vaccination clinic site for homeless people was established, again demonstrating our commitment to those members of the population who are excluded and vulnerable. Our ongoing commitment to the people of Hull is that over the next 6 months of our existence, or the last 6 months, we will make sure that the mechanisms, arrangements and relationships that we've established are maintained and enhanced wherever possible to make sure that the legacy of the CCG is protected and the huge problems the system continues to face are tackled with the same determination, focus and passion. I'd like to thank all the practices, all our partners in health and social care, the local authority, volunteers, and particularly the patients and the public of Hull who have supported us over the past 8 years. And we've tried to be open and honest and upfront with you. We would not be where we are today in terms of the pandemic, as I said, without the 40 million vaccines administered by primary care. And now we have the boosters and the flu campaign. And also, in addition to thanking you, the public, for your engagement, I also thank you for your patience in this very, very difficult time that we're all facing as we try and establish health and social care services over the next months and years to come. Thank you. I think we've now got another video.
Thank you, Dan. My name's Erica Daly. I'm the Interim Chief Operating Officer at NHS Hull CCG, and I wanted to share this evening some of my reflections on the past year of recovery and response to the pandemic. Talk to you about how that really informed how we prioritised and focused on our most vulnerable communities. And the main feature that ran through the whole of the year was around partnership, because it was really significant how all the partner agencies came together to ensure that we could respond. And it's also the foundation on which we're going to build our system as we move forward to make the success of our move from a CCG into the integrated care system. So I wanted to start by just highlighting the range of partners who work with the CCG, and on behalf of my team at the CCG, thank all the organisations highlighted there on the slide and their teams for all the work that they've undertaken, and the collaboration, the creative thinking and the initiatives that have gone into play into the last year to make sure that we could respond quickly, but equally when the pandemic started to subside, that we could make sure that we were putting services out there that were learning from how they'd responded to COVID and continuing in that recovery phase to make sure we were getting the best outcomes for our health and our communities in Hull, and to deliver our collective ambition to deliver better outcomes for health and care. So just to focus on performance, as Emma and Dan have alluded to, we have faced some significant challenges. Those have certainly affected access of waiting times and the timeliness of that access for people who live in the city. We had to really make sure that access and quality of care was a priority as we worked through the pandemic and particularly as we emerged out of it. And what I want to do this evening is just share with you some of the particular areas where that partnership came together to focus on our most vulnerable and already disadvantaged populations in the city. Some of the projects that I'm going to highlight, and there were very many, so it was very difficult to choose from them, could not have been achieved without that collaboration across the whole system. So firstly, the work to support children in the city. Hull already has around 65,000 children living in the city, and about 9,000 of those already live with a significant disability or need additional help with their education and health needs. So we looked at the two priorities which we could focus on to support them. A lot of this work has been done alongside those communities, alongside parents and children, and they've worked with us to develop a different service model around our neurodiversity services. This is a particularly difficult area in terms of access, and we've had some challenges in terms of how we've managed waits for services. The new service, which has been designed by parents and young people, even down to the logo competition that we launched, will now look at making sure that all those referrals are received into a single point of contact, that it will reduce duplication. Teams will work together to make sure that there's an initial contact, and we reduce the duplication of effort, the duplication of referral, and make sure people get access to the right service first time. Humber Foundation Trust have worked closely with us on this alongside other community partners and our colleagues at the hospital, and recently the Sensory Processing Hub website, which is the front-facing element of some of this work, was winner of the Health Service Journal Patient Safety Award. Alongside that, we know that children in the city have really struggled with the pandemic and the impact of COVID-19, homeschooling and not being able to mix and socialise with their friends. The mental health support teams into school has been really instrumental in making sure that we can get that support into the schools. Its premise is that we work around the principles of early intervention and prevention, getting children to open up and talk about their emotional health and well-being, and we're currently supporting 34 schools across the city with that initiative, which we hope will grow as we move into this next year. Frailty and older people. We've talked about the success of the Jean Bishop Integrated Care Centre before, but I wanted to focus this evening particularly on the rapid changes they had to make to their service. As the pandemic hit, they were no longer able to bring patients into the integrated care centre. So the team there worked with all the partners across healthcare, primary care, the ambulance service, and our care homes, social care and the voluntary sector to redesign that offer and make sure that they could continue to support our most frail and elderly populations so that they could continue to receive care, had instant contact to that clinical advice and guidance, and wherever possible were receiving care in their own home and reducing the need to go into hospital. You can see there that over the course of last year, from April to April, they received over 6,700 calls into a specialist frailty advice and guidance line. And this is an example of where we put something in to address the pandemic, but we've kept that in because of the benefits that we're seeing in terms of positive patient and carer experience, really positive in terms of the support for our care home staff and care home residents. And we've reduced the number of people having to attend A&E and be admitted into a hospital as a result of that advice and guidance line. So it's a really good example of that rapid service design in response and an excellent example of partnership, shared goals and collaborative working. Emma talked about how we're going to move into new arrangements for our partnerships in Hull. Our responsibilities will be delegated by a new integrated care board, and that will mean that we'll need a new committee arrangement to be established in the city. We're currently working with our local authority and other partners to look at how that might work, how we can establish that and how we can build on the strong partnerships that we already have. Partnership with the community, though, needs to be central to that, and our new organisational structures will reflect how we continue to work with our communities, listen to what they tell us about how they need the services redesigning and work alongside them to continue to develop some of the initiatives and creative approaches that we've done as a CCG over the course of the last few years. As our CCG changes, our functions and responsibilities may change, but our strength in working together as a city will remain. So following this short presentation, we'll have a pre-recorded presentation from Emma Sainer, as we talked about earlier. But I'm going to leave my presentation with a short story from Danny, who accessed the lung health checks in Hull. We did have to stand down the service during COVID, but in the short 5 weeks that it was operational, 848 lung health checks were carried out across Hull, and 18 cases of cancer were discovered, and the appropriate treatment followed. The service has now been back up and running since June of this year, and we look forward to more success stories like Danny's. Thank you.
I'm Christine, this is Danny, and we're both married. Been married for a lot of years, haven't we? Yeah. A lot of years. Well, we both went for it, and then we got a phone call the next day.
The unit was in little car park at the time.
And it's not as scary as you think it's going to be, and the staff in there are just brilliant. They put your mind at ease as soon as you go in. And he was told to had an appointment the day after, and that's when we found out that he'd got lung cancer.
I've been smoking heavy now since I was 13, you know, and I'm 66 now, so...
Everybody who smokes nearly all has a smoker's cough. Yeah. That's what we put it down to, being a smoker's cough. And so we found out at the scan that it was lung cancer. So if it hadn't been for this, it definitely wouldn't be in now. Yeah. More or less the next day or so, wasn't it? I made an appointment to go to a no-smoking clinic, and we both got into that, and we're both now a year and about 3 months no smoking.
It's half an hour out of your time, you know, and it could save your life. So we encourage anybody, if they get a letter, to go.
Good evening, everybody. So my name's Emma Sainer, and I'm the Chief Finance Officer at Hull CCG. Just amazing to see the outcome for lung health checks, and essentially, you know, the reason that we're here. I have the pleasure of taking you through the statutory part of the annual general meeting this evening. And in particular going through the financial performance for the financial year 2021. I am actually going to take the unusual step of doing a little bit of context, because as you've already heard, this has been a really, really unusual year. I'm then going to go through the detail of the financial performance targets, and then a little bit of outline about where our money goes, and then finally finishing on what matters to me. So in terms of context, those of you who've heard me speak before, finance is a fundamental part of enabling delivery of patient care, but it isn't an outcome in itself, and it must be aligned to the priorities that we are setting ourselves as organisations and as services going forward. And I truly believe that we have a role in enabling innovation and encouraging sort of positive change. So, 2021, there were a few big things that happened that affected the world that I operate within. Firstly, as we were moving into the financial year, my deputy CFO was taken very, very seriously ill, and he left the organisation immediately. I'm really pleased to say he made a fantastic recovery and returned to work very, very swiftly and continued to deliver for the vast majority of the financial year. But I just wanted to take the opportunity to thank the wider finance team for stepping into the breach. The toll it took on them whilst we were dealing with the pandemic was not, well, it was immense. And so I wanted to specifically say thank you to Sarah Milner, to Victoria Remington and Andy Parsons. And just to say, Danny, thank goodness you're back and well, and as I say, continued to deliver during the financial year. I cannot sort of go on without referencing the pandemic. It affected everyone and everything. And you've obviously heard some of the impact that has affected the wider organisation. And NHS Finance was no different. So the usual financial regime that we have grown up with and know inside out was suspended. And it became really vital that we, as a priority, flowed cash into our providers as a priority. To some extent, the financial agenda sort of took a step back, and quite rightly so. But certainly the volume of work that the finance team, the very small finance team, have undertaken during the year didn't go away. They have worked incredibly hard and tirelessly, sort of responding to all of those different changes. And overlaid with that, the CCG, we've taken a wider system role on behalf of the Humber and the wider integrated care system, as you'll have heard others speak to previously. And so again, just wanted to say a huge thank you to the whole of the resources team that I have the pleasure of managing. They stepped up to the plate incredibly, providing, moving into different roles, showing huge amounts of resilience and flexibility. So a huge thank you for that. So moving on to the sort of business end of my presentation, have great pleasure in saying that we achieved all of our financial targets through the financial year. That included delivering a break-even position. I will go into some detail on the next couple of slides around what that looked like, because the numbers do look a little bit strange for 2021 compared to previous financial years because of the regime that we were operating within, the way the money was flowing through the system. Really pleased to say we achieved our running cost target. Again, we have very strict targets around the amount that we have available to operate the CCG, and we have a really close eye on making sure that's as low as it possibly can be. Management costs and bureaucracy is something that we all want to keep to an absolute minimum, and I think this is a really good indication of that. Again, those of you who've heard me speak many times, paying bills is a huge priority, and paying them on time. And again, during the pandemic, never was it more the case that we needed to get cash out and cash quickly into the economy. And finally, just to say, we ended the year with another sort of clean bill of health. For the 8th year running, we had an audit with no recommendations. And again, it's a presentation of thank yous, but I did want to say thank you to both our internal and external auditors, because they really worked with us through some very, very challenging changes and timescales. And whilst absolutely doing the job that they were there to do, they did it with a really flexible approach, which we certainly appreciated. The next 2 slides get into a little bit of the detail of where our money goes for the CCG. And I was just going to highlight a couple of key sort of areas of interest. They're all interesting, obviously, but just some of the key things. First of all, you will see that in 2021, we spent £80 million more than we did in the previous year. That wasn't all just for Hull CCG, and that's where you will see some of the impact of us taking a leadership role. So quite a bit of that money was being deployed into, well, it was all being deployed into services, but on behalf of other partners within the wider healthcare system across the Humber and across the integrated care system. So in particular, the first line, the investment within hospital services, that was because we were essentially under the pandemic regime for finance, which meant that Hull CCG was flowing more cash into the hospital regime on behalf of other organisations and other populations. The next slide just shows you the same thing but with percentages. And again, you'll be able to see how the resources have been deployed and how they've changed during the different financial years over the past sort of 4 years. Again, there's a lot of context that sits behind those numbers, and if you are interested in some of the analytical review as we describe it and the changes, then I would really urge you to read the annual accounts. They are actually quite interesting, really, but I would say that, wouldn't I? So finally, really wanted to just give a sense of what matters to me. Obviously, I would love us to continue to deliver our financial duties, but again, most importantly is that we are achieving value for money. I'm really keen to make sure that we keep the good that we've achieved through the pandemic, particularly in terms of how we use our resources. And we are moving into new arrangements at the end of this financial year that we're currently in, so at the end of 21-22. And I'm really keen to make sure that we have a safe transition of both the money, but most importantly, our staff into those new arrangements and the integrated care system. I am really excited about the new arrangements. I think they enshrine what we've been trying to achieve for the CCG for the past, the past decade, really. I think this gives us an opportunity to do some of that, particularly working alongside our local authority and making sure that we're continuing to look and question ourselves and make sure that our resources are going to the places that are most needed, particularly around the health inequalities that we face within Hull. And I'm really keen that as we move into the new arrangements, that continues to be the case. There is one pot of money, and over and above all, there's only one workforce, and I think the workforce is our biggest constraint. Again, you might be surprised to hear a finance person say it's not all about the money. The workforce is by far and away the biggest constraint we face, and I think the role of finance now and into the future is about how we make best use of that workforce going forward. Thank you very much.
Good evening, everyone. My name is Jason Stamp. I'm the lay member for Patient and Public Involvement and Vice Chair of the CCG. So thank you to our panel members for their presentations, but but unfortunately your work is not quite finished, as we're going to move on to our annual question and answer session. So this is my favourite part of the AGM. It's the chance and the opportunity for you to ask questions of health leaders and get some answers for the things that really kind of matter to you. So, as you know, we're holding the event virtually, and usually we would give you the opportunity to ask questions from the floor, but we've asked you to submit those questions to us in advance. We've had a large number of questions this year, and we're not going to be able to answer all of them, but there have been some key themes that have come out of this, and actually we're going to use the opportunity to ask some questions around themes where hopefully those individual questions will be answered. It does mean that we won't be able to take any live questions, but if at the end of the session you do have any questions that are outstanding, then we'd be more than happy for you to submit them and for us to respond to you outside of this session. So the way we're going to run this, I'm going to read out each question, I'm going to ask one of the panel members to respond with the answer, and we'll make a start on the first question. So this is for you, Dan. Given government guidance suggesting GP surgeries and doctors should offer face-to-face appointments again, why are so few GP surgeries and doctors in Hull offering face-to-face appointments? And what action has the CCG taken to ensure face-to-face appointments return to pre-COVID levels?
Thank you, Jason. And as you quite rightly say, there have been lots of questions around this because it's obviously a very important topic and one that's causing not only patients a lot of anxiety, but I can also assure you that general practice itself is really exercised by issues around access and delivery and the changes that they've had to make in their service very quickly over a short period of time. Prior to COVID, the way that GP surgeries operated was changing, and I've been talking about this for years. So GPs are one part of a GP surgery. They're surrounded by support staff, which have increased in numbers, people who are really able and willing and qualified to help patients who contact the surgery, and also with wider primary care, which is the way that patients first access the NHS in the community. So that's community services, urgent treatment centres, community pharmacies, and minor injuries unit. And practices have been continuing to offer face-to-face appointments. We know that patients prefer them. Some patients actually prefer other forms of consultation. They've been doing that in the context of some severe challenges, particularly around the start of the COVID pandemic. At that time, 85% of consultations pre-COVID were done face-to-face, but suddenly that wasn't possible. However, face-to-face consultations were continued when clinically necessary, and we had to work very hard to secure PPE for practices. It was very labour-intensive, very difficult to continue to provide face-to-face consultations to those who really needed it. That figure dropped to about 15% at the start of the COVID pandemic, and we're now back up to 60% of all appointments in general practice in Hull are done face-to-face. That was July 2021. And in that month, nearly 120,000 appointments were booked with Hull practices. Interestingly, nearly 6,000 of those were DNAs or did not attend. So one of the reasons why it may be difficult to obtain face-to-face appointments is because we're still having difficulty with a relatively high number of what we call DNAs or did not attend. 70,000 were face-to-face appointments. 70,000 of those appointments were face-to-face with doctors and other GP practice staff. And interestingly, almost 2/3 of all booked appointments were either the same day or the next day. So that's 60,000 same day or next day appointments were offered with GP surgeries in Hull. So face-to-face appointments are still going on. And since July 2021, the expectation is that the need for face-to-face appointments should be discussed and agreed between the GP and the patient. And for many patients, it's not clinically necessary for a face-to-face appointment. And I'm not saying this in terms of there isn't a problem. I know that people are concerned about it and people would want face-to-face appointments where possible, particularly where necessary. And I'm sure that GPs would like to offer more face-to-face appointments if they were able to do that. But this blended approach of non-face-to-face and telephone or video consultations has actually allowed GP surgeries to provide 14% more appointments post post-pandemic, as in April 2020, well, it's not post-pandemic, in April 2021 compared to April 2020, GP surgeries were able to offer a 114% increase, or a 14% increase in the number of consultations they were able to offer. So doing that has increased the number of appointments that GPs have been able to offer. And social restrictions in terms of social distancing, etc., disinfection and cleaning, still apply in healthcare settings. So that happens in GP surgery. So that makes it a little bit more difficult to go back to the full face-to-face, if it were desirable. So practices now allow for patients to interact with them through a variety of methods, not just over the internet. And we have set up a group in the Humber Coast and Vale to look at what we call digital inclusion or exclusion, because we do realise that it can be difficult for people to access primary care, and I use the term primary care because that's the whole of services available to patients in the community, through non-face-to-face ways of doing that. Previously in the past, those patients who lived nearest to the surgery often had the best access. That situation completely changed with COVID. We're getting back to more face-to-face appointments, but it's not within the gift of the CCG to make GPs do face-to-face consultations. It's up to them to decide if it's appropriate or not. Sometimes it is, sometimes it isn't. And there are alternative ways of accessing general practice services through, or minor injury services through local pharmacy, NHS 111, and also the NHS app. So that gives you a sort of flavour of where we are. We try and facilitate wherever possible GP surgeries to offer face-to-face, but they obviously have issue with their staff around having to socially isolate. Now that kids are going back to school, there's much more COVID in school children, so people are having to stay off work to look after that. So it's been a real challenge for practices, and so that's some of the reasons why the practices have not been able to offer the same number of face-to-face consultations.
Thanks, Dan. Okay, so the second question, Erica, this one's for you. So we're moving from primary care to flu. So why are pensioners expected to travel from one side of Hull to the other to receive their flu vaccinations? Can a more local offer be arranged?
Thank you, Jason. So the National Influenza Vaccination Programme is commissioned by NHS England, but it is delivered through our GP practices and community pharmacies. And I think the first thing to say is that people shouldn't have to travel. So unless you're a patient who's registered with a GP on the other side of the city, or there's no capacity in a local community pharmacy, there's no reason to travel to the other side of Hull to receive your vaccination. So if that's happening and there are individual cases of that, then if you want to contact us through our PALS service, we'll certainly look into it. But it's a really great question because it's really important to raise the importance of having your flu vaccination. There are two really important vaccinations to have this winter, and that's your flu vaccination and your COVID booster jab. It's important because flu kills over 11,000 people across the country and hospitalises tens of thousands of people in an average year. So thank you for the question, and if there are individual issues accessing the vaccination, then please get in touch with us.
Thanks, Erica. So Dan, back to primary care. So what will the CCG do to make it easier for patients to contact their GP surgeries by telephone and reduce call waiting times?
Yeah, thanks, Jason. This is a real problem for you. I absolutely fundamentally understand that, and it's something that practices as well are well aware of, the difficulties that they have around contact and access. And the last thing that practices want are patients waiting for a long time on the telephone, finally getting through, frustrated and annoyed by having to wait such a long time, and then finding that there aren't as many appointments as they would hope that was the case. We're operating in a system which is basically supply and demand. Demand has gone up hugely over the period of the pandemic. We've got patients who for understandable reasons didn't come forward during the COVID pandemic with existing health problems. As you're probably aware, the hospital, they had to do a similar thing around their outpatient appointments. So many patient appointments were cancelled because of COVID and advice to avoid healthcare settings. That blew back into general practice with people trying to contact general practice via the telephone. And that was the same with other services as well. And people in the past, obviously the default position has been trying to get through to their GP on the telephone. And just as way of example, one practice informed me that it was the Monday after, the Tuesday after the May bank holiday in May. From their phones going over to 1:30 in the afternoon, they had 3,000 telephone calls. 3,000. And were able to deal with 1,700 of them by 1:30 lunchtime. I think that was a phenomenal achievement, but it does give you an idea of the very, very high level of demand that is going on at the present time. It's greater than it was before we ever had lockdown. So we've got, as I said, we've got people now trying to access care that they've been put off before, people waiting further investigations and tests and treatment. And the other thing that I really wanted to mention, I know this is something that's dear to our hearts and particularly Jason's, there's been a huge increase in the amount of mental health problems and presentations into primary care and general practice. So there's demand that has existed purely because of COVID. It's not pent-up demand or delayed. So this is why there is so much pressure on telephone lines into practices. This is why we've been working with practices and PCNs to look at how they provide telephone services, identifying funding and support, introducing new systems that some practices have done with increased queue capacity and increased functionality, queue buster options, also using SMS text messages. Certainly my practice contacts me about appointments and blood test results, etc., via text messages, and I find that particularly convenient. We also have, we're working with practices and also with what we call the NHS Regional Primary Care Team to try and resolve these concerns. And part of that is actually widening the number of roles within primary care, such as physicians associates, such as pharmacists, such as nurse practitioners and care navigators. So patients in the end will find out who the best person is for them to contact and have the option to be able to contact them directly without going through the huge bottleneck that can be the telephone access to general practice. So it is something that we are absolutely aware of, committed to do something about, understand that it is a major problem. And I just want to reassure you that our practices know it's a problem as well, and they have got as much interest in sorting this problem out and trying to make it as easy for patients as you have, because it's a real issue at the present time. Thank you, Jason.
Thanks, Dan. So, Erica, next one for you. This is condition specific. So when will polycystic ovary symptom patients get the full help they need? And why can't PCOS patients get free treatment to rid these patients of unwanted hair growth?
Thank you. So we do acknowledge that polycystic ovary syndrome can cause increased hair growth, and that can be due to the associated hormone imbalance. However, because increased hair growth can occur naturally, that doesn't always cause clinical concerns. It's not something that's routinely commissioned. However, it doesn't stop an individual making a request via their GP. We do have a policy to look at that, and individuals can speak to their GP about applying for funding where that's appropriate. So again, it's a very individual issue, and I think it's something that we would want to support people if they want to contact us via PALS or speak to their GP. There is a policy whereby if that condition is causing particular issues that are clinically associated, then GPs can contact the CCG and we will look at each of those in turn.
Thank you, Erica. Okay, so this one's for you, Dan. So we've spoken a lot about COVID and the impact of COVID. So here's a question about long COVID. So many thousands are suffering from long COVID and are off sick claiming statutory sick pay. What additional financial wellbeing support is available for those off work suffering from long COVID?
Thank you, Jason, and thank you for the question. It's a good subject to talk about, really, because up to fairly recently there was quite a lot of discussion about long COVID, and people were trying to work out exactly the nature of it, but it does seem to have certain characteristics associated with it. And the question talks about financial wellbeing support. I'd also want to talk about the health and also the psychological aspects of it as well. And I think we're still really coming to terms with what it actually means. But it's been a worry for us, not just in the from a health point of view, but also obviously for employers and employees, people wanting to get back to work, people in education, etc. And recovery time from COVID-19 is different for everyone, but most people's symptoms resolve by about 12 weeks. But obviously, in addition to that amount of time that it takes to recover, then people's experience can vary as well. There are those people who've got pre-existing conditions, those people who may have suffered from chronic fatigue in the past, let's say, have had a previous experience of a post-viral syndrome. But so it can affect patients in different ways and different times. So the NHS really, through our Humber regional subsystem, we've commissioned and set up a new service for people in Hull with ongoing symptoms of post-COVID syndrome, particularly where their condition has not improved after 12 or more weeks. And then it fulfills the definition for long COVID. So the Humber Long COVID Triage and Assessment Service brings a range of health professionals that I've talked about, whether it's physical health, mental health, psychological, social, etc., to ensure patients are referred onto the right clinical pathway to support their rehabilitation and recovery, because it is about rehabilitation and recovery for this particular condition, as we learn more about it. Your GP would be able to refer you, if appropriate, to the new service. And also, there's a NHS Your COVID Recovery website, which has a lot of information about it. And we've also produced a booklet to help deal with that as well, for exercise with breathing, managing cough, coping with post-COVID fatigue and other impacts. That information is available on our website. As to the financial and wellbeing support, we, alongside the local authority, commission quite a few services to help in this. So help general welfare advice, including financial welfare, is available through agencies such as the Citizens Advice Bureau. In Hull, we also commission a welfare advice service that's accessible through the GP, or you can self-refer through Connect Well by searching Connect Well Hull on the internet. So that's self-referral, so you can get advice and help and guidance from that point of view. And each prescribing primary care network also has a social prescribing link worker who can signpost into relevant support. And I'm sure that they can be accessed by dropping the practice an email or contacting them by other means, or even writing them a letter. They should be able to do that. So there are physical and welfare support available for patients suffering from long COVID.
Thanks, Dan. So the next one's yours, Erica. There's a running theme of vaccinations for you tonight. I'm not quite sure that's about. But this one is about COVID-19 and the booster. So when will GP practices in Hull offer the COVID-19 booster jab, and what is the order of priority?
Thank you. A really good opportunity to promote the boosters and getting vaccinated. Our booster programme has already started in Hull. The prioritisation is very similar to what people will have experienced when the vaccination programme first started. It's nationally set guidance that we follow. So in the first instance, our most clinically vulnerable patients and people over 70 will be the first to be contacted by the NHS. Patients don't have to seek the booster. They will be contacted by the NHS, and they will be the first cohort, closely followed by people over 50, care home residents, frontline health and social care workers, and anybody with specific underlying health conditions. So it's through the national booking system. Social care workers can self-identify, but all patients will be contacted in due course. So just an opportunity to say it's never too late to get your COVID vaccine if you haven't already. Adults who receive 2 doses of the vaccine get the best protection, but we're only recommending at the moment children get the 1 dose, and our programme for children 12 to 15 up to 17 years is also underway. It's really important, even if you've had coronavirus, to get the vaccine. And you can get details of our walk-in sessions across the city at the CCG website.
Thanks, Erica. Very clear message there. So, Dan, this one's yours. So this one is quite complex. I'm going to go through the question quite slowly. So, for my own benefit, because there's lots of words on the screen. So, since NICE approved Sativex in November 2019 to treat people with multiple sclerosis for whom other treatments for spasticity had proved ineffective, individual funding requests have been refused in our area. Currently, only 49 out of the 106 of England's CCGs are funding Sativex. I am concerned that people with MS in Hull may purchase the drug illegally in order to relieve this very debilitating symptom if they cannot afford to pay privately. When will you end this postcode lottery and make Sativex available to Hull residents?
Thank you. Yeah, it's a really important question, and it was brought to my attention actually quite a long way in front of the annual general meeting, and we'd already started to do some work on this, and I thank people for that as well, and the opportunity to update people. So there was recently revised NICE guidance, the National Institute for Clinical Excellence. So we've been working with Hull University teaching hospitals, the Multiple Sclerosis Service, the consultant neurologist, to develop a new policy that makes Sativex freely available to individuals with MS who particularly meet the NICE criteria. There are particular criteria under which the drug can be prescribed. And what we're doing is developing those criteria, really working with our colleagues at the hospital. And the reason for that is because the drug can only really be prescribed under the clinical, what is called the clinical oversight, or it's the responsibility of a consultant that the patient may be under at the trust. So it still isn't something that GPs can prescribe. It's what in our formulary or our list of drugs that we can prescribe, it's classified as a red drug. So it can only be prescribed by a consultant who's looking after the patient. And the consultant at the present time is developing the sort of conditions, if you like, under which it can be prescribed. So while this work is being undertaken, Sativex will continue to be available via an individual funding request, but we're hoping very soon that we'll have the guidelines in place that will allow the consultants to prescribe the drug. The GP will have a role in that, but it can only really be prescribed by a secondary care colleague. In the meantime, we can support patients on an individual basis through our PALS service, which will be available on the literature that we send out. It's available on our website. So there are developments in this area, and it will be becoming more available to patients as we work through it. But there is, I appreciate, a sense of urgency about that. I fully appreciate that.
Thanks, Dan. So moving on to the last question. For those of you watching online, you may have noticed that Erica Daly has seamlessly changed into Emma Latimer by the trick of magic. So this one, Emma, is for you. So, is it fair for GP receptionists to have to take a series of phone calls from understandably frustrated and poorly patients, many of whom have spent up to an hour in a phone queue? What can be done for patient and staff wellbeing to reduce mentally harmful experiences like this?
Okay, thank you, Jason. I think, like Dan said, we understand how frustrated people have been. It's been really quite difficult to access general practice. I hope Dan has allayed some of those fears for you. But the health and mental wellbeing of our entire NHS workforce is very important, as is supporting and improving morale in NHS staff, as that will help to improve patient experience. So as a CCG, we've been supporting our local medical committee around tackling abuse of patient and practice staff in the first of a three-phase public awareness campaign around improving experiences for patients and staff. This campaign has wide support and asks everyone to think about how their behaviour can impact others. So I think my message to people is be kind. I think through the pandemic we've seen everyone being kind to each other. People were hugely kind to NHS staff, clapping every week. And I think, just remember that we're all patients, we all access primary care, and we all have the same issues, but we can only solve these problems if we work together and be kind to each other and treat each other with respect. So I think our staff have overcome some of these challenges, but there is a NHS People and Humber Coast and Vale Staff Resilience Hub that has been set up to provide additional support and counselling to those staff who are affected, and more information can be found at our website. Thank you.
Thanks, Emma. So that is the end of the questions. Thank you to everyone who submitted a question. Hopefully the answers you've heard have offered you some reassurance and kind of clarification. Apologies that once again that we couldn't cover every single question, but if there are any other questions that kind of arise after today's event, please use the email address which is now on the screen. And I'm going to hand over to Emma, who will close tonight's AGM.
Thank you, and thank you everybody who's been involved tonight, to all the panel who've given their time. Hopefully we've been able to answer your questions, and hopefully you've seen the tremendous work that we've done as an organisation. I think, as Dan said, we don't always get it right, but I've been really proud to lead this organisation over the last 9 years. I think that the Hull CCG team have truly connected with our communities. I think that we've worked way beyond traditional health commissioning, as you can see, the creativity, the innovation, the first for things we've really got alongside our communities to try and help and support people in a way that I don't think I've ever seen before in my career. I think most of the CCG team have spent their lives in the NHS, and we join the NHS to help people in some small way, and I hope you can see that throughout our journey we've tried to help as many people as we can. Not to say there isn't a huge amount to do, and we've outlined some of those challenges tonight, but I really do think the power of partnership here has been fantastic, and I would like to say thank you to all of our partners who've helped us along the way, because without you we wouldn't have got here. I also want to say an absolutely massive thank you to my chair, Dr. Roper, who has given his absolute life to the NHS, not just in a consulting room, but in his leadership, his skill, his ability, his gravitas, the way he supported this organisation, and general practice and everybody else. You know, he's been front and centre, leading things in the pandemic, always brave, courageous, never afraid to do the right thing, and I'd like to applaud him and thank him immensely for the time he spent with us. He really is an absolute legend. So, and in terms of the rest of my team, obviously, with Erica has really had to support the organisation over the last 18 months with the COVID response and led the organisation and managed it tremendously well. My team, as I said, are just amazing. I have to thank every one of them for all the passion, the creativity, and the leadership that they've given to Hull over the last 9 years. Also to my governing body, the GPs, my vice chair and the lay members, who again provide fantastic challenge and support. You know, we don't always get an easy time, as you wouldn't expect, but they've been hugely fantastic in their advice and support and guidance and challenge along the way. I'd also like to thank all our practices who are members of the CCG. Again, without you, I don't know, we wouldn't have got through COVID. And all our partners and the voluntary and community sector, who again do so much in this city. Also to the public, you know, you've come on this journey with us. You've turned up at loads of the events that we've had the pleasure of being at before. You've supported us, you've helped us, you've directed and guided us in some of the things we've been proud to talk about today. And I hope that that continues. Whatever structure goes on in the NHS, it doesn't matter. It's all about people, and people are the same and the issues are the same, and we need to make sure we address those going forward in whatever structure that may be. So thank you all for everything you've done, and I hope you've enjoyed the session today. So have a lovely evening, and thank you for those who've logged in tonight. As Jason said, if there's anything you want to find out after the event, our details are available. Thank you.